Welcome back to our channel. Today, we're delving into the fascinating world of hemoglobin testing. Specifically, we'll explore the hemoglobin Hplc electrophoresis test, its specifications, associated diseases, specimen used, components, test report time, and much more. Before we dive into the specifics, let's understand what the hemoglobin Hplc electrophoresis test is all about. It's a vital tool in diagnosing various blood disorders, especially beta thalassemia. Now, let's break it down step by step. Pre-test information. Before undergoing the test, it's crucial to gather some pre-test information. This includes understanding the purpose of the test, any necessary preparations, and what to expect during and after the procedure. Purpose of the test: to diagnose blood disorders such as beta thalassemia. Any fasting requirements. Depending on the laboratory, fasting might be required before the test. Potential side effects or risks: minimal risk of bruising or bleeding at the site of blood collection. Post-test instructions. No specific post-test instructions, but it's essential to follow any recommendations provided by the healthcare provider. Specification of test. Now, let's talk about the specifications of the hemoglobin Hplc electrophoresis test. This test is specifically designed to measure the percentage of fetal hemoglobin in the blood sample. It utilizes high-performance liquid chromatography or electrophoresis techniques for accurate analysis, measures percentage of fetal hemoglobin in the blood sample, utilizes high-performance liquid chromatography or electrophoresis techniques, provides precise and reliable results for diagnosing blood disorders, diseases associated. The hemoglobin Hplc electrophoresis test is particularly valuable in diagnosing beta thalassemia, a genetic blood disorder characterized by reduced hemoglobin production. Elevated levels of fetal hemoglobin are indicative of certain blood disorders, making this test indispensable in their diagnosis. Diagnosis of beta thalassemia, an inherited blood disorder, helps in identifying other blood disorders with elevated levels of HbF, enables healthcare providers to tailor treatment plans based on accurate diagnosis. Specimen used. Now, let's talk about the specimen used for this test. Typically, a blood sample is collected from the patient, usually through a vein in the arm. This sample is then processed in the laboratory to extract and analyze the hemoglobin components. Blood sample collected from the patient via venipuncture. Anticoagulants may be added to prevent blood clotting during sample processing. The sample is handled and stored according to laboratory protocols to ensure accurate results. Components include: the components of the hemoglobin Hplc electrophoresis test include various types of hemoglobin, such as adult hemoglobin and fetal hemoglobin. These components are separated and quantitated to determine their respective percentages in the blood sample. Adult hemoglobin, predominant type of hemoglobin in adults. Fetal hemoglobin, present in fetal life and gradually replaced by adult hemoglobin after birth. Other hemoglobin variants may also be identified depending on the individual's genetic makeup. Test report time. Finally, let's discuss the test report time. The duration for receiving the test results may vary depending on the laboratory and the specific method used. However, in most cases, results are available within a few days after the sample is collected. Turnaround time for test results typically ranges from 1 to 7 days. Rapid testing methods may provide results within hours for urgent cases. Patients are advised to follow up with their healthcare provider to discuss the results and any necessary further action. And there you have it. The hemoglobin Hplc electrophoresis test is an invaluable tool in diagnosing blood disorders like beta thalassemia. By understanding its specifications, associated diseases, specimen used, components, test report time, and pre-test information, you're better equipped to navigate the world of hemoglobin testing. Don't forget to consult your healthcare provider for personalized guidance. Thanks for watching.